Morning, America, and good evening, India. It is unclear when the president contracted the virus, but there are two broad phases of a coronavirus infection. The first, where the virus is the problem, and the second, deadly phase, when our immune system goes into overdrive and starts causing massive collateral damage to other organs. Treatments fall into two camps: those that directly attack the virus and more likely to be useful in the first phase, and drugs to claim the immune system which are more likely to work in the second. So, what drugs are being used and what do they tell us about his condition? The doctor with only one patient, the president. Second, Trump's busy week before testing positive for COVID. Third, what can the president learn from illness of UK PM Boris Johnson? Fourth, the unanswered question from Trump's diagnosis. Dexamethasone, the steroid saves lives by climbing the immune system, but it needs to be used at the right time. Give it too early and the drug could make things worse by impairing the body's ability to fight off the virus. This is not a drug you could usually give in the mild stage of the disease. A trial of the drug which took place in the UK showed that the benefit kicked in at the point people need oxygen, which Mr. Trump did briefly receive. Dexamethasone, life-saving drug. The World Health Organization advises using the steroid in severe and critical cases. Mr. Trump's blood oxygen levels did dip below 94%, which is one of the National Institutes of Health criteria for severe illness. However, those low oxygen levels were not sustained, and the gap between someone needing transient oxygen support and advanced COVID is massive. Some have suggested that the president could be incapacitated because of the effects that the steroid can have on the mind. Dexamethasone's side effects include anxiety, altered mood, and cognitive impairment, but these are more common and prolonged use rather than the short course that Mr. Trump is currently receiving. Monoclonal antibody therapy. This is a combination of antibodies made by the company Regeneron, which mimic our own immune response. The antibodies physically stick to the coronavirus so they cannot get inside the body cells, and they make the virus more visible to the rest of the immune system. Last week, the company published a result on its website showing the cocktail reduced the amount of virus in the body as well as the time it took patient to recover. However, this was in people who did not need hospital treatment, and the data has not been seen by scientists or doctors. The approaches make scientific sense, and there is huge hope it will be effective. However, the evidence in patients is still very limited, and those monoclonals are still classed as an experimental drug. Clinical trials are ongoing. The president is one of only a handful of people outside those trials to undergo the treatment under what is common as compassionate use. Remdesivir. This antiviral drug was first developed as a treatment for Ebola. It works by confusing the virus as it looks chemically similar to some of the raw materials the virus needs to replicate. This disrupts the virus's ability to make thousands of copies of itself. Clinical trials have shown the drug cuts the duration of symptoms from 15 days down to 11. However, there is no evidence that lives have been saved with remdesivir. Like monoclonal antibodies, remdesivir is likely to have a